DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey there, folks. Welcome to DocTalk. I'm Dr. Dan Thomson, and today we have a special guest, Dr. Kevin Hill, and we're going to discuss vaccinating calves. And we're going to talk about anything from how we prepare the cows for the calves, to the calves at branding, to weaning, and talking about your customer. We're sure glad you joined us here on DocTalk, and we'll be right back after these messages.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey, folks, welcome to DocTalk. I'm Dr. Dan Thompson, and I'm here today with Dr. Kevin Hill, who is a veterinarian with many, many years experience and over 27 to 30 years in Kaysville, Utah, as a cow-calf practitioner, bovine practitioner. One of those people that as I started coming out of veterinary school, I was listening to his talks, listening to things he was doing in practice, and now he has been a technical services veterinarian where he can pass that knowledge on to other veterinarians through Merck Animal Health. And Dr. Hill, just thank you for being with us.
Hey, thank you, Dan. It's always fun to talk with you.
And so today we're going to talk about vaccinations and specifically getting those calves immunized. But talk to me a little bit about some of the things we do before the calf is born to enhance that colostrum.
Yeah, that's a great point to always keep in mind. I always tell people if you've got any calf health problems in the first month or two of life, you've really got a colostrum problem. And either that cow didn't have good colostrum or she didn't transfer it to the calf when he was born. But if the converse of that is also true. If you've got good colostrum, if you get good passive transfer, then you're set up, for good health. So, yeah, that starts typically in the fall. Good decisions about what to vaccinate your cow for then. It's going to help supplement that colostrum. And so, yeah, typically, we're given maybe some viral shots and IBR, BVD, some clostridial booster at that time to that cow. In some situations, also a vaccine for scours prevention would be another item. But the main thing is to think through those things in the fall when you've got the opportunity with the cow to get some of those things done.
I think that so many times when we have the cow caught or we have the opportunity is usually when we do things. And as we start to think about, if we start to think about things we can be preparing for, I think that's vitally important. But the other question I get, Kevin, is when these calves hit the ground, is there anything that people are vaccinating for, and obviously we want them to work with their local veterinarian because they know the region, but what are some things that maybe we think about there?
A lot of the country is selenium deficient, and so one of the important things can be providing some additional selenium to that calf. So Merck has a product that's been used for years and years called Bosi. That works well. Multivitamin has some selenium in it. That can help. So thinking about selenium is an important thing. Other parts of the country also have a lot of issue with Clostridial disease, and some parts even a fairly rare or less common type A Clostridial problems. So depending on the area of the country you're in, you may want to give a C&D Clostridial antitoxin and toxoid when they're. Those would be the primary things for people that could historically have had pneumonia issues between birth and calving. Then those are people that may want to think additionally about some respiratory protection, and more common use now with intranasal vaccines really makes that possible. So you can get a newborn really good protection using intranasal IBR, BRSV, PI3, that combo. So that's a fairly important new addition.
Awesome. Well, that gets us rolling and off to a great start, folks. I'm here with Dr. Kevin Hill. More from Doc Talk after these messages. Hey, welcome to Cattle First, sponsored by Boehringer Ingelheim Vet Medica. There's two reasons why animals get sick: overwhelming dose of a pathogen or a suppressed immune system. Number one cause of a suppressed immune system is stress. We need to make sure that we decrease the stress of cattle. Low stress cattle handling, acclimating these cattle when they come to your facility, making sure that cattle can trust you. So building trust with cattle, just like you would with a dog or a horse on your property, is vitally important, because animals that don't trust you won't show you clinical signs. Once you gain those cattle's trust, all of a sudden one of them says, hey, I'm not feeling good, take me to the hospital and treat me. Otherwise, they think you're a predator and they mask their clinical signs and you don't catch them. This has been Cattle First by Boehringer Ingelheim Vet Medica.
When you're in the cattle business, no matter how much it's a business, it still starts with cattle. It's this basic notion that sits at the core of how we approach things at Boehringer Ingelheim. We understand when you put the cattle first, it just naturally leads to doing the right things. If you want to do well in this business, you start by doing right. Take care of the cattle, and they'll take care of you.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey there, folks. Welcome back to Doc Talk. Dr. Dan Thompson with Dr. Kevin Hill. And Dr. Hill is a bovine veterinarian who has practiced in Cato, Utah for many moons, and now serves as a technical services vet, sharing his information and wisdom with veterinarians, supporting their practices through Merck Animal Health. I'm Dr. Dan Thompson here at Iowa State University, and we're glad to be with y'all today. And Dr. Hill, you know, we get that calf on the ground, we get them to that, you know, when do you kind of recommend people do their branding or bringing those calves in for their summer turnout shots?
Well, that's an interesting question. When I recommend it may not be when they can do it. So maybe I'll just switch right to that when can they do it question, because that's changed a lot in the last few years. You know, we've been recommending that people match their calving more to the grass season. And so there's been a lot of people who started calving a little later, and yet their turnout dates stay the same. So there's really quite a bit of pressure now to vaccinate a very young calf. He may be only a few weeks old when they want to vaccinate so they can get them turned out. So, and And that can be some problem, although we know that young calf is fully able to respond to vaccinations. They're just not quite as mature, and so we need to keep that in mind. And the younger they are, the higher the level of maternal antibodies that they're still dealing with. And those antibodies that were in the colostrum, we hope they got, have the potential to block a lot of our injectable vaccines. So that all sets us up for a really good opportunity to use intranasal vaccines. They just do a great job in those young calves. So that would be my first start, is to say, whenever we're vaccinating a calf that's less than, say, 3 months of age, we have to use an intranasal vaccine wherever we have one to cover what we're looking for.
Yeah, and I think that's important for people to understand that maternal antibody, the reason why someone vaccinates a puppy at 6 weeks, 9 weeks, 12 weeks, 16 weeks, is because we know somewhere between there that maternal antibodies that come down and the vaccine won't be blocked, and it'll take over. And usually in these beef calves, we just get one shot at it.
Right, right. And so getting specifically into what are we going to give in those vaccines, we certainly want to cover our major viral respiratory diseases, IBR, BVD, BRSV, and then we want to get some clostridial coverage started in those calves too. And so if we do those two basic things, then we're going to have a good start.
You bet. We got about 30 seconds before we have to go to break. Any kind of words of wisdom for folks during that branding time, vaccine related or not?
Yeah, when I go to a branding, it's typically the guys with any experience want to be on their horses, and the kids and the people that have coming to their first branding, something simple to do is give them a gun and let them give shots, and we got to turn that around. And I mean, the whole purpose we're doing this is to get a brand on them, but also to get those vaccines into them. So we ought to have experienced people doing that, so we don't have mistakes, and it gets administered. If it gets squirted on the ground, it just doesn't work very well.
Great advice. Well, folks, we're going to take a break. When we come back, more with Dr. Kevin Hill.
When you're in the cattle business, no matter how much it's a business, it still starts with cattle. It's this basic notion that sits at the core of how we approach things at Boehringer Ingelheim. We understand when you put the cattle first, it just naturally leads to doing the right things. If you want to do well in this business, you start by doing right. Take care of the cattle, and they'll take care of you.
ValleyVet.com is your one-stop shop for your every animal need. From prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson, and I'm here with Dr. Kevin Hill, and we're both veterinarians. Dr. Hill is a bovine veterinarian out in Kaysville, Utah. Many years of practice, and just somebody that has brought a lot to our bovine medicine community. So if you ever get a chance to listen to him speak, you should go. He is a technical services veterinarian now for Merck Animal Health, and we're tickled to have you on the show and talking about vaccinations. Let's talk a little bit about pre-weaning or weaning or getting those calves ready to leave the ranch.
Okay. I think the first thing that a producer needs to have clearly in mind is who he's preparing those calves for. So if he's going to keep those calves himself for 60, 90 days maybe after they wean, then he has a pretty clear idea of what he wants to accomplish. But the majority of people are going to put them on a truck and send them off to a buyer or a feedlot somewhere. So they need to have that customer in mind. and be in step with what those people value, what they're going to be willing to pay you for, and then vaccinate them accordingly. So that sort of sets the stage.
You bet. And so as we think about those different scenarios, what are some of your core, principles to preparing those calves, or some of the things, whether it's vaccine related or just like when you left us on the branding, immunizing and vaccinating are different. There are different definitions, and we can get the vaccine in them. It doesn't mean they have an immune function. So what are some of the things that you kind of work with your clients and people around the country?
Well, I put a lot of emphasis on managing stress. Weaning time is the most stressful time in a calf's life. I mean, up to that day, things have been beautiful, sunshine and birds are singing, and mom is always nearby, for a good meal. But if we gather cows, separate them, calves from cows, process them, load them on a truck, and ship them 300 miles on the same day, you're asking for a wreck. And so one of the principles is to try and spread those different stressors out. And that's why we like to precondition. We like to get calves in 2 or 3 weeks before we're going to ship and get those vaccines started so that they have a chance to work, and they're also working under less stressful conditions. So that's a big deal, is just don't hammer those calves with too many challenges all in one day, and they'll perform pretty well for you.
Yeah, they, when I think you're spot on. Low stress cattle handling, not too many hiccups. Without getting into some of the specifics, anything else that you're working with groups on as far as like vaccinations, dewormers, things to that nature, equipment, and that we're going to need to go to break here pretty quick. But I thought, why don't we end on something like that?
Yeah. So there's, besides just vaccines, there are those other things to consider, especially if you're going to retain calves for 45 days or more. Then certainly deworming those calves is going to pay back easily for you, and you should consider implanting, because that'll pay back. And for that guy that's going to background, the key to that being a profitable enterprise is whether or not those calves gain weight, and if they stay healthy. But that's critical. So anything that's going to promote weight gain is going to be important to them.
We're going to take a break, folks. When we come back, we'll wrap up with Dr. Kevin Hill. You're watching DocTalk, and we're sure glad you joined us.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
When you're in the cattle business, no matter how much it's a business, it still starts with cattle. It's this basic notion that sits at the core of how we approach things at Boehringer Ingelheim. We understand when you put the cattle first, it just naturally leads to doing the right things. If you want to do well in this business, you start by doing right. Take care of the cattle, and they'll take care of you.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to Doc Talk. Dr. Dan Thomson here at Iowa State University, and my guest, thanks to the internet, is Dr. Kevin Hill. He is a practitioner, bovine practitioner from Kaysville, Utah, and is finishing his career, or this phase of his career, with Merck Animal Health, and has spent a lot of time helping us as veterinarians better understand vaccinations, dewormers, raising calves, feeding cattle, and much more. So it's a pleasure to have you on the show. And let's kind of, Dr. Hill, let's get back to what products do you recommend when we're weaning these calves?
All right. Again, the number one health this age calf is going to have, a weaned calf, is obviously respiratory disease. So that's our big focus. Clostridial diseases are out there, so we'll just kind of quickly say give a clostridial booster to cover that, and then we can refocus on respiratory issues. So we should have in mind, what are the main causes of respiratory disease. So there are viruses like IBR, BVD, BRSV would be the big three. And then if we think about our bacterial causes, Mannheimia hemolytica, Pasteurella multocida would cover those. So when you look at your vaccine program, those are the things that you want to cover. And again, thinking about your customer, a lot of our vaccination protocols today are driven by our feedlot buying customer. And so they're wanting that viral protection and asking for that bacterial protection as well.
You bet. Well, and we've all sat there, but I really think that IBR, the BVD, and if the Mannheimia is going to be effective, getting it on ranch and letting the calf build antibody. I think we've learned more about antibody and building antibody and antigen through this COVID crisis than any time we've ever heard all this. But any comments towards the products and their timing?
Yeah. Again, let's go back to preconditioning. If you have an opportunity to precondition calves, that's the way to do it. You can minimize the whole stress picture we talked about before, but you also give the vaccines time to work. Everybody knows that they don't immediately provide protection. If they have 2 to 3 weeks to build antibody levels and the other cells that are important in immune function, then that calf's going to be very well protected. If you just vaccinate him as he gets on the truck, he's going to have a tough time. Now, one of the interesting things we've done, using nasal vaccines in our baby calves, we also done a lot of nice experiments with Dr. Griebel in Canada, one of the best immunologists in the world, where we compared vaccinating calves with intranasals and injectables at weaning time. And we were surprised to find out that those intranasals were more effective when we looked beneath the surface at viral shedding and all these details. They're the most effective of all. So that's sort of the future. I think we're going to learn more about how to use intranasal vaccines, this mucosal immunology in the older calves as well as we have in the young calf.
Well, I want to thank you for being on the show. I want to thank everybody for watching today. Remember, if you want to know more about what we do, you can find us on the web at www.doctalktv.com. I'm Dr. Dan Thomson, here with Dr. Kevin Hill. We recommend you work with your local veterinarian, and we'll see you down the road.
DocTalk is brought to you by Merck Animal Health, the science of healthier animals. ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.